Hello and welcome to the Pharmacy Informatics Professor 2020 with your host, Dr. Armin Simonian. Now, I'm a pretty chill guy. It takes a lot to get me agitated or upset, but that's exactly what happened when I saw a recent ad for a new OTC product. So to me, this was something that was a pharmacy informatics nightmare. It was a med safety issue and maybe a case where a manufacturer has put profits before safety. But let me start at the beginning and tell you the whole story, and then you can see if you agree that this is really a problem with the launch of this new drug, this new OTC drug. So the first thing I want to do before we get started on the complete story is give you a pop quiz. All right, here's your quiz. So what were the generic names of the following histamine 2 receptor antagonists, H2RAs, these medications as of April 1st, 2020? And the brand names are Tagamet, Pepcid, Axid, and Zantac. Can you name the generic names? All right, let's go to the answers. Tagamet, cimetidine, Pepcid, famotidine, Axid, nizatidine, and Zantac, ranitidine. And it's this last one where we have an issue. So let's go back and get into the story of how this all evolved and what the end result was. So on April 1st, 2020, the FDA requested manufacturers to withdraw all Zantac and generic Zantac OTC drugs from the market. And the problem was there was a cancer-causing agent that was found as a contaminant, and that is NDMA, N-nitroso-dimethylamine. And so the drug was withdrawn from the market back in 2020 on April 1st. The next thing I saw on TV were a lot of ads from law firms offering assistance to patients who were taking Zantac, who might have developed cancer. And so this happens with drug recalls very frequently. When patients are harmed, there's an opportunity for lawyers to get involved and make a case, and then for the patient to get compensation for the trauma that they're going through. So this was something that I saw happening a lot with these ads from law firms offering to represent patients who had taken Zantac and ended up having cancer. Now, what I found very upsetting after that is just recently, Zantac OTC came back on the market as Zantac 360, but under a different generic name. So they basically changed the ingredient. It's still an H2RA, but now when you order Zantac 360, you are getting famotidine and not ranitidine. Now, for the pharmacy informaticist, this is a nightmare. So let's walk through what I would have done if I was managing a database where we had CPOE in a hospital system. So as soon as we found out that Zantac and all the OTCs were being withdrawn from the market, we would have either deactivated that drug in our database, or probably more likely, we would have put in a CDS type warning, a pop-up, so that if a prescriber were to pick Zantac, it would come up with a message saying this drug has been withdrawn from the market, and give the prescriber, who might have been unaware of the withdrawal, a chance to pick a different product. And in the message, we could even suggest some alternatives. After a period of time, that would be inactivated, Zantac would be gone, and that would be it. Unfortunately, what happened in this case is Zantac came back as a brand name, as Zantac 360, but it's still Zantac. and it has famotidine instead of ranitidine. So now, as a pharmacy informaticist, if this is something that's going to be prescribed, then if the prescribers are expecting to see that drug available in the drug database, and of course all of this would have had to go through P&T committee, but if it was approved, then Zantac would have been reactivated or added back into the drug database with a generic name of famotidine. Now, this is, to me, a med safety issue. You might say that it's a minor one, but a prescriber who wasn't aware of all of this that was going on with the withdrawal and the addition back into the system might think that they're prescribing ranitidine when in fact they're prescribing famotidine. So to me, this is both an informatics nightmare and also a med safety issue. And it can cause confusion. And now within our system, if the P&T committee approved entering Zantac 360 into the system, when the physician or prescriber ordered famotidine, there would be 2 brand names associated with it. And if they ordered Zantac thinking that they're getting ranitidine, they would really be getting famotidine. So again, as a pharmacy informaticist in this case, when we added Zantac 360 back into the system, then I would have probably added a note on that product to make sure that the prescriber was aware that when they were ordering Zantac now, they were not getting ranitidine, but they were getting famotidine. So let's go back to our pop quiz and do that one more time. Getting back to our quiz, so now the wording has changed a little bit, but if we were to name the generic names of the following H2RA medications, then in this case you see Tagamet is still cimetidine and Axid is still nizatidine, but both Pepcid and Zantac are now famotidine as the main ingredient. So you see the issue here, the confusion that can be caused. And again, luckily it's the same class of drugs and might have a similar profile in terms of action and even side effects, but they are 2 different medications, and this can cause confusion amongst prescribers. And it's something that probably would have been better brought back to the market under a completely different name. And I think that would have been a safer and clearer situation in terms of the drug database and prescribing. So that was the issue. And, it did get me riled up a little bit. And so I just wanted to talk about it and just mention that when you are doing pharmacy informatics or med safety, little decisions like this by drug manufacturers can really have a big impact on your work in terms of maintaining drug databases and keeping the system safe and notifying prescribers of changes that have occurred with their ordering choices with medications. So something to keep in mind that's potentially can happen again in the future. It's happened in the past, not just with this medication, but with other medications too. So something that we have to be very aware of and be able to deal with as it occurs. So as always, if this video was helpful for you, please like it and subscribe to my channel, and I will thank you for that. And in the meantime, stay safe, stay healthy, look after the health of others, because that's what we do as pharmacists. I'll continue to work on more episodes, and I hope to see you next time. Take care.